everyone, and thank you for joining the NeedyMeds special topic webinar, The Financial Impact of Cancer, presented by Triage Cancer. My name is Carla. I'm the Director of Education and Partnerships at NeedyMeds. And before we get started, I'd like to cover some tips so you can get the most out of today's presentation. First of all, you can feel free to ask questions at any time by typing them into that question section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have a chance to answer your question, we will follow up with you by email. And of course, we'll provide the contact information for both Triage Cancer and NeedyMeds at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find our PowerPoint slide decks in the handout section of your control panel. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded just over 2 decades ago by a retired physician, Dr. Rich Sagel. Rich is still our president. What you're looking at on the screen is all of our formal wording, including our mission statement, our vision statement, and a statement about how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And I always like to put up a screenshot of our homepage because our website is really the face of our organization. And it gives me a chance to point out just a few things. First of all, if you're looking for healthcare savings resources, check out that Patient Savings tab. If you're interested in educational information, such as ordering brochures and drug discount cards, signing up for future webinars, or getting on the list to receive our monthly newsletter, you would do all that under the Advocates tab. I mentioned that this webinar is being recorded and will be available on our YouTube channel, and you can find a link to that on the top right of our homepage with the rest of the social media icons. And I suggest subscribing because that way you'll know when new content is being added, and so you won't ever miss out on a webinar, a video, or presentation. And you can always check out and register for all upcoming webinars on the calendar of events on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And we do that by letting them know about NeedyMeds, but also by letting them know about other resources available for specific diagnoses, which is why we're so pleased to have our guest here with us today from Triage Cancer. Triage Cancer is a national nonprofit that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. It's my pleasure to introduce Monica Bryant, Esquire, who's going to walk us through tips that will help lessen the financial impact of a cancer diagnosis and treatment. Monica is a cancer rights attorney, speaker, and author. She is co-founder and chief operating officer for Triage Cancer. Throughout her career, she has provided hundreds of educational seminars, written articles and blogs, appeared on TV and radio shows, and authored a book on cancer rights law. But today, we are so fortunate to have her here with us. So with that, I'm going to go ahead and hopefully seamlessly pass the mic and the screen to Monica. So bear with us while we do that. It may take just a moment. And as we're transferring the screen, a reminder that if you do have questions, you can go ahead and submit them into that question section of your GoToWebinar control panel. With that, I'll pass the mic to Monica. Thanks, everybody, for your patience, and enjoy the presentation.
Thank you so much, Carla. I'm delighted to be here today to talk to you a little bit about health insurance. As Carla mentioned, I am a cancer rights attorney, but please know that everything I'm going to talk about today is in fact relevant to all of us as healthcare consumers. We just happen to talk about these issues through the lens of cancer. So as Carla mentioned, Triage Cancer is a national nonprofit that provides education on all of the practical and legal issues that can arise after a diagnosis of a serious illness like cancer. And of course, today we're going to be talking about health insurance specifically. So we know that when somebody is diagnosed with a serious illness in this country, oftentimes they experience something called financial toxicity. And really, that's just a formalized way of talking about the financial burden that is often accompanied with a serious diagnosis. And that's because our healthcare system can be challenging to navigate. So what are the major contributing factors to financial toxicity? Certainly, having adequate health insurance is a huge component. Employment changes, life changes, all of those things are going to impact somebody's finances. But the major challenge with dealing with financial toxicity is that most people don't even understand the American healthcare system or their health insurance. So this study was done and it showed that 96% of Americans couldn't even correctly define major terms that are used in health insurance. And when asked, were they confident in being able to choose the right health insurance plan for them, only 40% said that they felt confident. So it goes to show that if 96% of Americans don't even understand what they're purchasing, how could they possibly be purchasing or be confident that they're purchasing the right products for them? So with that, I'm going to start back at the basics to make sure that we're all on the same page. In this country, there are 3 places where we get our health insurance. The largest number of Americans get their health insurance from an employer. The next largest group is going to get their health insurance from the government, primarily through Medicare or Medicaid or a military-related plan. And then the smallest number of Americans get their health insurance directly from a health insurance company. But regardless of where you get your health insurance, you have to understand the basic terms. And the basic terms are the same across the board. So when we're talking about the costs associated with having health insurance, there's the premium, which is what you pay every single month just to have health insurance. And you're going to pay this amount whether you go to the doctor or not. It's very similar to having car insurance all year and never filing a claim. But then there are some extra costs or additional costs when you actually go and use your health insurance. The first is your deductible. And this is a fixed dollar amount. It is going to vary plan to plan. So some plans have a $3,000 deductible. Some plans have a $50 deductible. Some plans have a $0 deductible. But it's going to be given to you in a fixed dollar amount. And it's the amount that you have to pay each year before your health insurance company starts picking up their share of the cost. So their share of the cost is also referred to as co-insurance or cost share. So 2 terms for exactly the same thing. Now, this is going to be given to you as a percentage. So for example, if you have a plan with an 80-20 cost share, that means that once you've met your deductible, your health insurance company will pick up 80% of your healthcare costs, and you're responsible for 20%. Now, in addition to your cost share, you may also have a co-payment. This is, again, a fixed dollar amount. It's going to vary plan to plan, but you're going to pay this each time you get care. So it's very common for plans to have something like a $25 co-payment each time you go and see the doctor, or a $250 co-payment if you go to the emergency room. And then finally, your out-of-pocket maximum. Now, I would argue that this is one of the most important things to understand about your health insurance coverage, because in most situations, it is the most that you're going to pay out of pocket per year for your medical expenses. And the way that you get to your out-of-pocket maximum is by adding up everything you've paid towards your deductibles, everything you've paid towards your co-payments, and everything you've paid towards your co-insurance. So it's everything out of pocket except those monthly premiums. Now, like with everything else, the devil's in the details. So typically plans will say we're only going to count payments towards in-network services towards your out-of-pocket maximum. And then some employer plans may actually carve things out of the out-of-pocket maximum. So for example, you might have an employer plan that says, we are not going to count any co-payments you make towards your out-of-pocket maximum. So it's very important to know how your specific plan handles that out-of-pocket maximum. But regardless, it is critical to understand that, because you can make some decisions and plan around a worst case scenario if you understand how all of this works. So I'm going to give you a very simplistic example to hopefully further illustrate how this all works together. So meet Dan. Dan has a plan with a $2,000 deductible. It's an 80/20 coinsurance, and his plan has an out-of-pocket maximum of $8,000. Dan hasn't gotten any other medical care for the year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan have to pay? So the first thing we always have to pay is that deductible. So he pays the deductible, it leaves $100,000 of that bill left. Now he has an 80/20 plan, so his co-insurance amount would be $20,000. But Dan has the plan with an $8,000 out-of-pocket maximum. So he's already paid $2,000 towards his deductible. So he has to pay another $6,000 of that co-insurance amount until he reaches a total of $8,000 and his out-of-pocket maximum. And he's not responsible for the rest of that $20,000. So I am not suggesting that $8,000 isn't a lot of money. Of course it is. But when we start looking at this in relative terms, $8,000 is certainly better than a $20,000 co-insurance amount, and it's certainly better than the $102,000 he would have to pay if he didn't have health insurance at all. So again, this is a simplistic example, but if you would like to hear what I just talked about, so the terms and this example, that is included in Triage Cancer's animated video on health insurance basics. So if you're sitting there thinking, gee, I wish so-and-so in my life could understand this or could hear that again, please let them know that in addition to watching this recording of this webinar on the NeedyMeds YouTube channel, they can also check out the animated video. I think it's only about 6 minutes long, and it's available in English and Spanish. Now, there are also some terms related to prescription drugs that I want to talk about. So when an insurance policy offers coverage for prescription drugs, they have something called the formulary. The formulary is just the list of drugs that the policy has said it will cover and at what amounts they're going to cover it. Typically, a formulary is going to be broken into different tiers or levels. And they might say, for something in the formulary generic tier, we're going to cover 80% of the cost, but something in the non-formulary brand, we're only going to cover 60%. So it's helpful to understand the various tiers and the various coverage options. Now, some plans may also require something called step therapy. And step therapy is when an insurance company requires individuals to try one or more medications, usually a generic or a lower cost medication, to treat a specific health condition. Then if that lower cost drug doesn't work, the patient's then able to step up into another medication that's maybe more expensive. Now, even if your plan does require step therapy, there may be some ways to cope with that if an individual and their doctor believes that a drug outside of the step therapy process is really the best choice. So they could get a prior authorization or something called an exception request to show that a prescription drug is medically necessary for that patient and why the insurance company should make an exception to their standardized step therapy process. So again, that's referred to as an exception request. Now, typically, if a prescription drug isn't included on an insurance company's formulary, then they're not going to provide coverage for that drug. But this is another example of when a patient might be able to use an exception request. And there's several types of exception requests. So maybe it's about requesting to cover a non-formulary drug. Maybe it's a tier exception. So requesting that the insurance company cover one drug as if it were in a lower tier. It could also be a brand exception. So some insurance companies will say, we're only covering the generic form of this particular drug. But maybe there's a reason that the patient can't take that generic drug. And then the doctor and the patient can file an exception request for that as well. So the key language here is really that it's all about medical necessity. Now, if you have questions about the appeals process, Triage Cancer has some information on our website under the health insurance section. But it's also something that you can work with your healthcare team on, and it's very important for your healthcare team to understand if you have concerns about your prescription drug coverage. Now, I mentioned that the largest group of Americans get their insurance from their employer. So it begs the question, what happens if somebody has a serious diagnosis and they have to take some time off from work? What happens to their health insurance? COBRA is a federal law that allows eligible individuals to keep their existing employer-sponsored health insurance coverage after experiencing what's called a qualifying event. So the benefit to COBRA is it's the exact same health insurance coverage, which means for somebody who's in the midst of treatment, they don't have to try to find a new policy with the same providers or prescription drug coverage because it's exactly the same as what they have. The downside to COBRA is cost, because typically with COBRA, the employee is now responsible for 100% of their premiums, plus sometimes a 2% administrative fee. So I would argue that most of us don't appreciate how much our employers pay for our health insurance until we have to write the check ourselves. So while COBRA can be a phenomenal option for some people, it can be very expensive. Now, COBRA applies to private employers with 20 or more employees, or state or federal governments of any size. Now, the length of time that you're allowed to keep COBRA is going to depend on your qualifying event. So generally speaking, if your qualifying event is that you're leaving your job, or even if you've gone from full-time to part-time and your employer doesn't provide benefits to part-time employees, that would trigger COBRA eligibility for up to 18 months. Let's say instead it's somebody who's aging out of their parents' policy, they would be able to elect COBRA for up to 36 months. Now, there's a handful of exceptions for when COBRA might last longer than 18 months, but not longer than 36 months. And of course, more information is available on our website. Now, typically with COBRA, you have 60 days to elect COBRA after your qualifying event. I did just want to mention that there is a new rule out of the Department of Labor related to COBRA, and it extends the election period, and by saying that the clock to elect COBRA doesn't start ticking until 60 days after the national emergency ends. So we are currently in a national emergency related to COVID-19 or coronavirus. So here is an example of how this works now. So let's just assume that the national emergency ended on April 30th. It obviously has not ended, but we're just making that assumption for the sake of the example. So it ended on April 30th. So now you're in a 60-day outbreak period until June 29th. Billy was let go from his job on April 1st, and he's eligible for COBRA. So the last day that he's allowed to elect COBRA is 60 days after that national emergency, that outbreak period ended. So he actually has all the way until August 28th. So I know it's a little bit confusing when it comes to the dates, but the point is just if you were eligible for COBRA over the last, 4 months while we've been in the state of emergency and you didn't elect COBRA and you're regretting that choice, you may still have that opportunity to do that given this new rule that has come out of the Department of Labor. Now, I mentioned that the federal law only applies to employers with 20 or more employees, but most states also have a state COBRA law. Now, the laws definitely vary state to state with respect to the details, but they're going to cover those smaller employers. So if you work for an employer with less than 20 employees, you're not going to be eligible for COBRA, but you might be eligible for similar benefits under your state law. Now, a lot of times people will say to me, COBRA is so expensive, why would anyone pick COBRA? Why wouldn't they just go into the marketplace and try to get a new plan? And it's true, COBRA can be very expensive. However, there might be some significant benefits to considering COBRA as an option. So the quality of coverage might be better with your employer plan that you would COBRA as compared with a new plan that you could get in the marketplace. Maybe your COBRA plan formulary covers the prescription drugs you're on, whereas a new plan wouldn't cover it. But it could actually also be that COBRA would be less expensive than a new plan. And the way that that typically happens is that somebody has already met their deductible or their out-of-pocket maximum for the year with their employer plan. If they were to go pick up a new plan in the marketplace, that would start over at zero, and they'd have to pay the premiums plus their deductible plus their out-of-pocket maximum again. So for some people, based on their situation, it may actually be cheaper or more affordable to pick up the COBRA plan and know that those higher monthly premiums are all they're going to pay for the rest of the year. So the point really is that you can't just make decisions without looking at the specific details. So the next largest group of Americans gets their insurance from the government, and I mentioned that's primarily through Medicare and Medicaid. Medicaid varies greatly state to state, and it's for individuals with lower incomes and lower asset levels. And if you'd like more information about Medicaid, you can always feel free to take a look at the health insurance page on Triage Cancer. But I wanted to spend some time talking about Medicare today. Medicare is a federal health insurance option for individuals in this country who are over the age of 65 or have been receiving Social Security disability insurance for 2 or more years, or have end-stage renal disease or ALS. Now, when we talk about Medicare, it can be incredibly confusing because there are, in fact, 4 different parts to Medicare, and the details vary depending on which part we're talking about. So Medicare Part A is your hospital insurance. So think of it, generally speaking, as anytime you're staying inpatient. So at a hospital, at a skilled nursing facility, in hospice. Part A is typically premium free for individuals who have worked and paid into the system long enough. Now, if someone hasn't worked and paid into the system long enough, they might still have access to Part A. They're just going to pay a monthly premium. There is also a deductible and cost share associated with Part A. Now, Part B is your medical insurance. And this is going to be your doctor's visits, preventative services, outpatient care, immunizations, home health care. Medicare Part B has a premium, even if you've worked and paid into the system. And that premium for this year is about $144 for most people. Some people will pay more based on their income for their monthly premium. Now, Part B also has an annual deductible of $198 per year. And Part B's cost share is 80-20, which means that somebody has to pay their $198 deductible first, and then Medicare Part B will start picking up 80% of their healthcare costs. Now, Medicare Part B does not have an out-of-pocket maximum. When we talk about Medicare Part A and Part B together, it is often referred to as original Medicare because Part A and Part B is all that existed when Medicare was first passed. Original Medicare is what's called fee for service, which means that you could go to any provider around the country that accepted Medicare and get coverage and obtain services. Now, Medicare Part D is prescription drug coverage. Now, this was not added to Medicare until 2003, which surprises a lot of people who aren't super familiar with the history of Medicare. So you'll see that some prescription drugs are in fact covered under Medicare Part B, and we'll come back to that in just a moment. But most prescriptions are going to be covered under Part D. Now, Part D plans are sold by private insurance companies. So the details are going to vary company to company with respect to the premium and the coverage. But the national average of Part D plans is about $33 a month for the premium. And the deductibles cannot be more than $435 for this year. Now, many Part D plans have deductibles less than that. That's just the ceiling. And again, the co-payments are going to be based, co-payments are going to vary based on the plan. Now, when Medicare was originally passed, it was designed in a way where there was a gap in coverage. And that gap in coverage became known as the donut hole. Now, I talk about Medicare a lot, and I have to say in most rooms that I'm talking about, people are like, oh, I've absolutely heard of the donut hole. And then I say, well, do you really understand the donut hole? And very few hands go up. And that's because it's confusing and doesn't make a whole lot of sense. I want to talk to you about what the donut hole looked like before the Affordable Care Act so that you can understand the differences that we have now. So this is how prescription drug coverage worked in Medicare Part D prior to the Affordable Care Act. So the patient was responsible for their deductible, which at the time was about $295. They would have to pay that out of pocket. Then they would enter the initial coverage phase. And during this phase, Medicare would pay 75% of the prescription drug costs, and the patient was responsible for 25%, until the total drug costs reached $2,700. At that point, the patient entered the donut hole. And in this time frame, Medicare paid nothing, and the patient paid 100% of their prescription drug costs until the total out-of-pocket drug costs reached $4,350. At that point, they entered the catastrophic coverage phase, where the patient was responsible for either 5% of their drug costs or a nominal dollar figure, and Medicare would pay 95%. So as you can see in that donut hole, there was a good period of time where people had to pay quite a bit out of pocket to get their prescription drugs. And when you think about the individuals who are on Medicare, seniors, individuals with disabilities, it is more likely that they have fixed incomes. And this was a significant burden and led to a lot of really sad situations, like people not taking their meds or splitting their meds in half. So when the Affordable Care Act was passed in 2010, it had multiple provisions to slowly close the donut hole over time. So 2020, the donut hole was completely closed, and this is what it looks like today in Part D coverage. The patient pays their deductible, which can't be more than $435. Then they enter the initial coverage phase, during which Medicare pays 75% of the prescription drug costs, and the patient's responsible for 25%, until their total out-of-pocket drug costs reach $6,350. And then they enter that catastrophic coverage phase, where Medicare pays 95% and the patient pays either 5% or a nominal dollar figure. So as you can see now, there is coverage the moment the patient meets that deductible all the way through, and there's no more donut hole. Now, you might be wondering, okay, well, why did she spend time telling us what it was like before if this is what we have now? The reason is because right now there is a court case pending with the US Supreme Court for them to decide if the Affordable Care Act is constitutional or not. And if the Supreme Court deems that the Affordable Care Act is unconstitutional, this goes away and we're back to a situation where there's a donut hole and patients are paying 100% of their prescription drug costs for a period of time. So if this is something that you care about, it's certainly an opportunity for you to go and talk with your elected officials about how losing the Affordable Care Act would impact you. Now, so we talked about Part A, which is hospital insurance, Part B, which is your medical insurance, Part D, which is your prescription drugs, which leaves Part C. Turns out that potentially keeping track of 3 different premiums and deductibles and cost shares, it's a lot. So an alternative was created in Medicare Part C, also known as Medicare Advantage plans. So these plans are managed care plans, which means that all of your care is going to be managed in one policy. Now, people can often choose between a PPO or an HMO when picking these policies. They have to include all the benefits and services that are covered under Part A and B. And about 90%, as you can see, also include prescription drug coverage. Now, these Advantage plans are sold by private insurance companies. They're going to have a very specific network of providers, much like private or employer insurance, but they may include some extra benefits and services for an extra cost. So what's interesting about Medicare Advantage plans is that the premium is going to vary plan to plan. Now, in the marketing of these Advantage plans, you will often hear, and probably these commercials will probably start in the next 2 months or so, about premium-free Advantage plans or premium-free Medicare plans. And it's a little bit misleading because with Advantage plans, you still have to pay at least your Part B premium. What those plans are saying is we're just not going to charge you anything over that Part B premium. But for a lot of people, they get confused and they think, well, why would I pay a premium in Part B when I can go over here and get a free Medicare plan? So it can be confusing to a lot of people. Now, because these are plans sold by private insurance companies, again, the details are going to vary plan to plan. So when we talk about the deductibles and the cost shares, those are all going to vary. Now, unlike Part B, Medicare Part C does have an out-of-pocket maximum. And this year, that out-of-pocket maximum cannot be more than $6,700. So this is often when somebody says to me, well, which is better? And my answer is, it depends. So it depends on your needs. It depends on what's available to you. There are some places in the country where the Advantage plan has everything you could possibly need, and why would you go elsewhere? There are some people who spend half the year in one state and the other half in another state. In that case, an Advantage plan with a narrow network of providers may actually not be a very good option. And having that original Medicare that's fee-for-service might make more sense. So I think the major benefit to the Advantage plans is that out-of-pocket maximum. Again, the major disadvantage is many of these plans are HMOs, and so they could have a smaller network of providers, and those out-of-network providers aren't going to count towards an out-of-pocket maximum. So it's not that one is good and one is bad. It's really just going to depend on somebody's needs and then what's available to them. Now, if somebody has original Medicare, there is an additional insurance plan that they can purchase. And these are called Medigap plans, also known as Medicare supplemental plans. These plans will pick up some or all of the out-of-pocket costs that you have with original Medicare. So when you think about, that chemotherapy is covered under Part B, and chemotherapy could cost thousands of dollars a month, and you're responsible for 20% of that, how do you deal with that issue? You do that through having a Medigap plan. Now, this is incredibly confusing to most consumers because Medigap plans are identified by letters A through N, not to be confused with Medicare Parts A through D. It happens all the time where we will get phone calls of people saying, I have Medicare Part F. And I have to stop and say, well, if it says F, then I think what you're talking about is your Medigap plan F. So I don't know why we couldn't come up with any other naming system, but here we are. Now, plans F and C were the most comprehensive because they picked up the Part B deductible and that Part B coinsurance, that 20%. Starting for people who are newly eligible this year, plans C and F are no longer available for purchase. If you've had C and F prior, you can keep them, but you cannot pick them up new if you didn't have them prior. So then we often get asked, well, which is the plan that has the next highest coverage? And it's probably going to be Plan G. Now, again, these plans are sold by insurance companies, and so the costs are going to vary company to company. And this is definitely one of those things that you have to do some, good consumer shopping around for, to make sure that you're getting the best coverage or plan letter for the best price for you. So all of that is to say, when somebody's trying to figure out what their Medicare options are, there's essentially two lanes that they can choose to drive in. The first lane is original Medicare, and that's where you would pick up Part A for your hospital insurance, Part B for your medical insurance. Then you'd ask if you want a prescription drug plan. I hope the answer is yes. And you'd pick a Part B plan that met your needs. And then you would decide if you wanted a Medigap plan to help cover those out-of-pocket costs associated with Part A and Part B. So that's lane one. Lane two, the alternative, is Medicare Part C. Now in Part C, you're going to have your A and B services bundled in a managed care plan. If that managed care plan does not also provide coverage for prescription drugs, you can pick up a standalone Part B plan. And that's where it ends for lane two. You are not eligible to purchase a Medigap plan if you're in lane two. And the rationale for that is because lane two also comes with the out-of-pocket maximum. So the theory is that the need for the Medigap plan is eliminated. Now, for individuals who are struggling to pay for their Medicare, there are Medicare savings programs to help pay for Part A and Part B. And then there is a low-income subsidy, also known as Extra Help or LIS, that can help pay for some Medicare Part D expenses. Some states also have a state pharmaceutical assistance program that can help pay for some premiums or drug costs, but they're not available in every single state. Now, I recognize that I went over that kind of quickly, and there's still some details I didn't get to share with you. But if you are either on Medicare or you're about to be Medicare eligible and you have questions, please know that we have lots of resources for you. So next month, we will be doing a free hour-long webinar just on Medicare. So we'll go over all the details and the enrollment periods and the late fees and all of that. And if you can't wait until September 15th for the information, we have last year's presentation archived on our website. Most of the information is the same. The dollar figures may be a little bit different because those change year to year. If watching an hour-long webinar isn't what you want to be doing, we have several quick guides on these programs, including a general one on Medicare, one on Medigap, and then one on the savings programs. And those can all be downloaded for free on the triagecancer.org website. Now, so we've covered employer-sponsored insurance, we've covered Medicare, which is the major government-sponsored insurance. So what about those people who want to buy insurance from an insurance company? Well, the Affordable Care Act, otherwise known as Obamacare, created the state health insurance marketplaces. When the law was originally passed, these were referred to as exchanges. Turns out, no one knew what an exchange was. So they got renamed marketplaces, and it didn't really help. There is still a ton of confusion about these, even though we are 6 years into them. We will get calls all the time where someone says something to the effect of, I have an Obamacare plan. To which then I have to let them know that they may have purchased it through the marketplaces created by the ACA. What they actually purchased was a policy from an individual insurance company. So that blue triangle up at the top is where the plans sit for the marketplaces. So then you might be wondering, well, if it's from a private company, why do I need to go through the marketplace? Why couldn't I just go straight to Blue Cross Blue Shield or Aetna, Humana? And the answer is there are some benefits to buying your policy through the marketplace. So companies actually have to apply and guarantee that their plans fit certain requirements in order to be sold in the marketplace. So there's some quality control. There's also a cap on the out-of-pocket maximum in the marketplace. So they can't be more than $8,150 for an individual. And again, yes, that's a lot of money, but when you think back to my Dan example, it's certainly better than not having any insurance at all. And then when we compare it with employer plans, there's a lot of employer plans that have an out-of-pocket maximum significantly higher than this. In addition to the quality control and the cap on out-of-pocket maximums, there may also be some financial assistance to purchase policies in the marketplace. And there's two different types of financial assistance. There's a premium tax credit that's going to reduce the amount that you pay monthly just to have the insurance. And then for some plans, there's going to be a cost-sharing subsidy or a reduction, and that's going to reduce things like the deductible or the co-payments. Now, it's really interesting because we still have roughly 10% of the population in America that's uninsured. And what's really interesting is when we look at the people who are still uninsured, we know that about 28% of those people could have gotten a plan in the marketplace for free. It's just that either they didn't think they could afford it, or they didn't think they needed it, or they didn't think they were eligible, or worse yet, they didn't even know the marketplaces existed. So it's really important to us for people to understand that this is an option for them to look at. And yes, it's going to be premium free, but there's going to be high out-of-pocket costs associated with those bronze plans. But the important piece, especially for us coming into the cancer community, is having a bronze plan means that you have access to certain preventative services for free, including some cancer screenings. So again, having some coverage, even if it's not the best coverage, is better than having no coverage. Now, the last kind of policy I wanted to talk about are short-term health insurance plans. These are plans that last less than a year. And because they last less than a year, they don't have to comply with the consumer protections created in the Affordable Care Act, like not denying someone coverage based on a pre-existing condition, or not charging somebody more because of a pre-existing condition. These short-term plans can exclude whole categories of care, like mental health or prescription drugs or chemotherapy. They have very high out-of-pocket costs. So why would somebody buy one of these plans? Well, on face value, they have very low monthly premiums. And when you compare them to the premiums in the marketplaces, they are going to seem even better. But the problem is they look very attractive with these low monthly premiums, but then when somebody goes to use the policy because they're sick or they need some sort of service, they find out that they have incredibly high out-of-pocket costs, or the plan doesn't cover the service at all. The Affordable Care Act limited these plans to 90 days with the understanding that really someone should only be getting one of these plans if they're trying to bridge a very short gap in coverage, like moving from one job to the other, and it takes 90 days for that other job's insurance to kick in. This administration, in a regulation released October of 2018, expanded the availability of these short-term plans. So now these plans are allowed to last 364 days, and they can be renewed. But there are no regulations on how much people can be charged for these plans if they get renewed, and they can end mid-year. When these policies end mid-year, they don't trigger a special enrollment period in the marketplaces. So it leaves people with serious medical illnesses without insurance until the next calendar year. So we talk about these policies because we're getting more and more calls from people saying, you know, my insurance doesn't cover my prescription drugs or doesn't cover my chemotherapy. And I think to myself, well, that's not possible. And then I think, oh, wait, do you have a short-term plan? And it turns out that they do. And that is happening more and more because the way that these plans are sold, it is not obvious that what somebody is buying is a short-term plan. There have been many states that have stepped in to try to stem the sale of these, and a handful of states don't have these short-term plans available at all. But I just really want people to be aware of what they're purchasing, and if they then make the educated decision that this is in fact the right thing for them, by all means go ahead. But we just hate hearing situations where people say, I didn't know, and I thought I was doing the right thing and buying comprehensive coverage, and it turns out they weren't. So when we talk about health insurance and making choices, unfortunately, it is not a one-time chore. We have to be reviewing our options every single year to make sure that the plan that we have for the coming year still meets our needs and is still the best plan available to us. And the good news is we have the opportunity to make those choices every single year now. So for somebody who's on or eligible for Medicaid, applications are accepted year-round. So as soon as somebody becomes eligible for Medicaid, they can apply and their coverage will begin. For the marketplace, generally speaking, people have to wait until open enrollment. Open enrollment happens every year in the fall. For many states that are run by the federal government, open enrollment for 2021 coverage will be from November 1st to December 15th of this year. Now, I said that for states with federally run marketplaces, that's the date. And that's because there are a host of states that run their own marketplaces. And many of those states, if not all of them, have longer open enrollment periods. And if you're wondering what's going on in your state, you can check out the Triage Cancer chart of state laws for health insurance. We have all of the state open enrollment periods listed right there for you. Now, Medicare also has an open enrollment every single year from October 15th through December 7th. Now, marketplace plans and Medicare plans are for a calendar year, which means even if you pick a plan in November, that plan won't kick in or won't start until January 1st of 2021. So very important not to drop any other coverage that you have until the end of the year. Now, employer plans vary, but most or many employer plans have an open enrollment period in the fall to coincide with the idea that then it's going to be a calendar year start date. Now, the good news is that the ACA recognized that things don't just change during open enrollment, and they created a special enrollment period, which means that when you have a life-changing event, so a change in your family, like the birth of a child, or you get married, or you've lost other coverage, like you've left your job or you've aged out of your parent's policy, it triggers this time period of 60 days where you can go and enroll in a new plan in the marketplace. So what that means now is that if somebody has lost employer-sponsored insurance, they have a couple of options now. So the first lane would be COBRA or state COBRA to keep their exact same policy they had when they were employed. Lane 2 would be a totally new policy through the marketplace special enrollment period. Lane 3 might be that they're eligible for another group plan. So maybe there's a spouse's plan that they can join or a parent's plan if they're under the age of 26. Or based on circumstances, they might now be eligible for Medicaid or Medicare. Now, the trick with this is people have to pick a lane and stay in it. They don't get to change lanes until the next open enrollment period. And where we see this happening is someone leaves their job, they think, okay, great, I'm gonna elect COBRA. They elect COBRA, 3 months in, they go, oh my gosh, this is so expensive, I want a marketplace plan. And it's unfortunately not possible until the next open enrollment period. And at that time, they can drop their COBRA and pick up a marketplace plan. So we have all these options now. How do we actually go about making choices between the different options? I'm going to give you an example using the marketplace, but please know that this analysis is the same regardless of if you are trying to compare two marketplace plans, if you're trying to compare two employer plans that are offered to you, if you're trying to decide, well, is my employer plan better or would a marketplace plan be better for me? Or even if you're trying to decide between your Medicare options, this exact same analysis is going to work. So here we have 3 different plans. We have a bronze plan with a $173 monthly premium, a $6,000 deductible, and a $6,000 out-of-pocket maximum. A silver plan with a $271 monthly premium, a $2,500 deductible, and a $5,200 out-of-pocket maximum. And then a platinum plan at almost $400 a month with a $0 deductible and a $1,150 out-of-pocket maximum. So just by looking at this, you can't actually tell which is going to be the most affordable plan, assuming you have a serious medical condition and you're going to hit that out-of-pocket maximum, which again, for the populations that I'm normally talking to, that is an accurate assumption. So assuming you're going to hit that out-of-pocket maximum, how do you tell which is going to be the most affordable come the end of the year? The only way to do it is by doing the math. And the way you do that is you take the monthly premium and you multiply it by 12, and then you add the out-of-pocket maximum. And when you do that for each one of the plans, you can see that platinum plan with the expensive monthly premium ends up being almost $2,000, actually over $2,000 cheaper than the quote unquote cheap bronze monthly plan, or excuse me, bronze plan with the 173 monthly premium. So we do this all the time, different numbers around the country. It always comes out a little bit differently. The point is that you can't just look at those monthly premiums. And that's what a lot of people do because they don't have the knowledge or understand how to do this math. But it's not just about the cost at the end of the year that matters. We also need to be looking at the deductible. So even if, let's say the silver plan and the platinum plan were very close in cost at the end of the year, there's still potentially a benefit to picking the platinum plan because of that $0 deductible. Because that means that on day one, that plan is going to pick up 90% of your healthcare costs right away. Whereas with the silver plan, you have to write a $2,500 check before your plan starts picking up even 70% of your healthcare costs. So making sure that you understand the deductible and how that works is going to be very important to your bottom line. Because for most of us, it's easier to pay a little bit more monthly in the premium than to write a big check at the beginning of the year. Now, if you would like to hear all of that again in terms of how to pick a plan and how to do the math and the other things to take into consideration, that is included in our animated video on how to pick a plan. And if you go to triagecancer.org, under the resources tab, you'll see animated videos as an option, and they're all available right there for you to watch. Again, it's available in English and Spanish, and we have Tagalog subtitles as well. Now, even if you've picked a perfect policy for you, you may still be faced with a claim denial. And that's where availing yourself of the appeals process is going to be very important. So there are two main types of appeals. There's an internal appeal where you basically go back to the insurance company and say, please reconsider. And then there are external appeals, which thanks to the ACA is now available in all states, even though some states had it prior under state law. Now, we know that 0.05% of all denials get appealed, which is an abysmal number. But we also know that of the claims that get appealed, somewhere between 40 and 60% of them are decided in favor of the patient. So roughly speaking, that means 50% of the time when an insurance company denies a claim, they're getting it wrong. And if you don't appeal, that means you're either not getting services that you need or you're paying more than you should be for those services. So understanding the appeals process, again, can be incredibly helpful, especially when we're talking about how expensive care can be. We have a webinar on appeals available. We also have a quick guide for free download on appeals if you want more information about the specifics. Now, if you are on Medicare, there is also an appeals process. It depends on if you have original Medicare or Medicare Advantage, the specifics. But the message I really want you to walk away with is don't just take no for an answer on face value if you get a claim denial. And when we talk about how to deal with the cost of prescription drugs and the cost of care, there are some really practical tips because we can't actually change the cost of care. So certainly appealing claim denials, getting help from charitable foundations. NeedyMeds has amazing resources on their website. Pharmaceutical companies have patient assistance programs. Sometimes that's about getting reduced cost drugs. Sometimes that's just about, we're going to give you information to help with your appeal. Also consider, pick a different plan next open enrollment if that's available to you. We have that option now. And so just because you racked up a huge amount of costs with this plan because it doesn't cover what you need it to, doesn't mean you have to keep going down that same road. And it could be about discussing alternatives with your healthcare providers. So maybe it's about a different dosage or a different way that it's administered can be very important. And that, for the sake of time, I won't get into details, but the message, again, I just want to leave you with is, if you're concerned about how to cope with the cost of your care, talk to your healthcare providers, because they may have ideas of how to get you the same quality care in a more affordable way. I also want to just leave you with the idea that if you think any of this is frustrating or that you wish things were different, that I encourage you to think about how you could advocate for your community, and that there are a whole host of legal and practical issues that can arise after a diagnosis of a serious illness like cancer and others, and that these are all of the topics that we have resources to help you navigate these issues on our website. And again, all of the services that we provide at Triage Cancer are provided completely free of charge. I also quickly want to mention that the issue about returning to work during COVID-19 has become very relevant for people in our community. And this week, tomorrow, in fact, we are hosting a free webinar to give you information about the latest laws that might be applicable to you. Totally free. You just have to sign up on our website today. So we also have a free conference coming up that will talk about all of these issues in greater detail. And then, of course, I've mentioned our animated videos. And so I want to leave some time for questions here, but please know that Triage Cancer can be a resource for you, and we hope that you will continue to have a relationship with us as well as with NeedyMeds. So Carla, I will turn it back over to you.
Monica, thank you so much for sharing your expertise with the NeedyMeds audience. Not only is it a great opportunity for people to really do more of a deep dive into these really confusing topics, but as you said in the beginning, although it is certainly for somebody that's been diagnosed with cancer or another serious condition or diagnosis, really what you talk about is applicable to all of us. And what I want to stress is what Monica wrapped it up with, that all of the resources that Triage Cancer offers, like NeedyMeds, are free. And you saw the breadth of information towards the latter end of her presentation that you will have access to. So I really stress familiarizing yourself with that Triage Cancer website so that you can sign up for conferences, for other upcoming webinars, and check out those animated videos that covers a lot of the information she delved into today. And as Monica said, we always leave time at the end for questions. I do see a bunch coming in, so don't hesitate to submit questions by typing into that question section of your GoToWebinar control panel. A reminder, if we don't get the opportunity to answer yours, you can certainly reach out to NeedyMeds or Triage Cancer, but we will follow up with you. What you're looking at on your screen is all of NeedyMeds' healthcare savings resources. So we do hope that you consider NeedyMeds a source of support if you are struggling to afford your medications or any healthcare costs. As I said in the beginning, you can find healthcare savings under that patient savings tab, but you can always reach out to our call center counselors if sometimes it's just easier, I find, to speak with an actual person. So don't hesitate to do that. And let's see, I also wanted to, as promised, leave up the contact information for both Triage Cancer and NeedyMeds as promised. So let's get to some of those questions coming in. The first one, and I thought this was a really good one, let's see, I have insurance through my employer, but the policy doesn't cover the doctors I want to see. Am I stuck?
Fantastic question, and one we get a lot, because prior to the Affordable Care Act, it could have been a different answer. But now we have the ability to look at the other options available to us, and that could include Marketplace. So I actually recommend that everybody, even if they get insurance from their employer during open enrollment, that they take a look at what's available to them in the marketplaces and they understand what the various options are. Now, I will say the one caveat to that is, if somebody is offered employer-sponsored health insurance, and that employer-sponsored health insurance is considered adequate and affordable, and there are specific rules to define exactly those two things. If it's adequate and affordable, then somebody could still go into the marketplace and purchase a new policy. They just wouldn't have access to that financial assistance I mentioned. But even without that financial assistance, if it's covering providers that you want to see, compared with your other policy that isn't covering providers, it may still actually be the more affordable option.
Thank you so much, and thank you for the question, because I feel like if an audience member, if there's one audience member thinking about it, probably there are others. So
Definitely.
Thank you for the question, and thank you for the thorough reply. Another question coming in. I've been told that when you first sign up for Medicare, if you choose a Part C plan, you have 12 months to reconsider and then go to original Medicare with the Medigap. Is that true?
So if you remember, I mentioned that Medicare has an annual open enrollment period every fall. And during that open enrollment period, that is when, even after 12 months, you can switch back and forth between those two lanes. And that is really important to know, because if, let's say, for example, someone is in a Medicare Advantage plan, and then they get a cancer diagnosis, and the doctors they want to see aren't in that network, that coming open enrollment period is an opportunity where they can go from Medicare Advantage into the other lane, into original Medicare. So again, very important to consider your options every single year to make sure that what you've chosen continues to meet your needs. And for someone who's interested more about switching back and forth with Medigap and Advantage and all of that, I highly recommend the September Medicare webinar, because we'll do a deep dive into all of those issues.
Right. I was going to actually say that as well, that would definitely be worth everyone's time to sign up for that. And Monica, I'll reach out to you and your team to make sure NeedyMeds that we have that on our calendar of events so we can share it with our audiences as well, because I think it's really invaluable. So another question coming in, is there an income eligibility required for Medicare Advantage? And why would you pick one over the other?
There's no income eligibility for Medicare Advantage, but there are some reasons why one might be picked over the other. So for example, Medicare Advantage plans might cost the exact same as Part B, but it may include prescription drugs, so you wouldn't have to pick up a separate Part D plan. Or it may have other services like gym memberships or covered dental and vision, which original Medicare doesn't cover. The major disadvantage to those Medicare Advantage plans is that they're often HMOs, which means there's a very small network of providers. So if you want to be able to go see a provider outside of that network, it's not going to be covered by Medicare, as compared with original Medicare, which again is fee for service, and that means that you can go to any provider in the country that accepts Medicare. So, you know, lots of pros and cons, and there isn't a one-size answer to that. It really is going to be up to each individual person to decide what they need. And if you feel like you need sort of that one-on-one assistance to help you make these decisions, I highly recommend reaching out to your state health insurance assistance program, otherwise known as SHIP programs. Every state has them, and their contact information is available on Triage Cancer under state resources, because they have people trained in Medicare, and you can actually set up appointments and sit down and talk through your situation with a human being.
Which again is sometimes what is really needed.
Absolutely.
Thank you, Monica. And we're going to wrap it up with just one more question because we do try to keep the question segment relatively brief. But again, don't hesitate to reach out to Triage Cancer or NeedyMeds at the contact information on your screen, or you can expect a follow-up from either Triage Cancer or NeedyMeds if you asked a question related to our organization that we didn't get the opportunity to answer. So we're going to wrap it up with this last question coming in, which is, I'm offered insurance through my employer, but every year I feel like I'm paying more and more out of pocket. Do you have any suggestions?
So it is a reality that you might be paying more each year because, like many things that we purchase, costs will go up periodically. We also know that when the Affordable Care Act was passed, costs of insurance went up, and the primary reason for that is because plans sold in the marketplaces, at least, the quality improved. So yes, you were paying a little bit more, but what you were getting was a significantly better product. If you feel like what you are paying for isn't meeting your needs, then I definitely recommend, it's really the same answer. You need to go look at what your other options are. Does your spouse have a plan you can join? Are you under the age of 26 to join your parents' plan? Look in the marketplace to see what your various options are. Does your employer offer more than one plan, and do the math there? And maybe your needs have changed year to year. So maybe you're out of active treatment for cancer, and so you might not hit your out-of-pocket maximum. So maybe then the math looks a little bit different for you this coming year as it did when you were in active treatment. But unfortunately, there's no easy button to press. We have to actually do the math and look at all of our different options, just the way that we would if we were comparison shopping refrigerators or washers and dryers or cars. We need to be doing the same types of things with our health insurance.
And I think that's a really good point, and that's one of the reasons NeedyMeds has forged such a great relationship with Triage Cancer, because there may be other organizations, I don't know of other organizations that have the breadth and scope of the resources Triage Cancer does. But what I most appreciate about Triage Cancer is they break down what I find to be very confusing and complicated information, and information that are heavy decisions. Picking an insurance plan for you and your family and your loved ones is a heavy decision. And I think that Triage Cancer does an excellent job with breaking it down into small, digestible chunks, making it understandable, and stressing the most important thing you can do is educate yourself. And some people say that, and it's like, well, go educate yourself, good luck. But when Triage Cancer says, listen, it's important to educate yourself, they basically can hold your hand and provide you all the resources you need in which to do that. And again, they do that for free, which really is invaluable. So as you can see, we really value our relationship with Monica and the Triage Cancer team. And I'm glad those that took time out of their busy days to join this webinar, I'm sure you'll agree that it was worth your time. So we're going to go ahead and wrap up because, as I said, I do try and keep the question segment brief, but we do hope to see your names pop up in future webinars, either through Triage Cancer or NeedyMeds. With that, a big thank you again to our audience, and thank you to Monica for taking time out of her day to share her expertise with our NeedyMeds audience. Thanks, everybody, and have a great rest of the day. And if you didn't get your question answered, we'll be in touch. Thank you.